Hello, I'm Dr. Milind Kadam, diabetologist from Thane, and in today's session we will discuss about the pedal edema as an indicator for the chronic kidney disease. So, what is pedal edema? Basically, it is the swelling of the feet and the ankles, and it happens because the fluid is pushed out of the bloodstream into these tissues where because of there is leakage into the small blood vessels, and because of that the fluid comes out of the blood vessels into the subcutaneous space, and it is enhanced because in what happens in kidney disease is the basic function of kidney is to filter the blood and throw the waste products from the blood into the urine through the kidneys. So when the kidney is not functioning properly, so the fluid and the waste material which gets collected inside causes the fluid overload. So this fluid overload in turn it acts as overload in the blood vessels, and that is why the blood vessels leak the fluid, and that is the reason of the edema feet which is visible. So in a chronic kidney disease, so one of the signs what the patient will show that there will be a bilateral edema. Now there are cases in which there is unilateral edema also, but then that is not the that doesn't happen in chronic kidney disease. It happens in other causes where there are other causes like deep vein thrombosis and other diseases where you can get a unilateral edema or filariasis and things like that. But as far as bilateral kidney disease, bilateral edema is concerned, chronic kidney disease is one of the main reason. Then there is a chronic heart failure. Then there is a chronic liver failure. Then hypothyroidism. These are the commonest causes of bilateral pedal edema. But amongst all these causes, the most common is the because of the chronic kidney disease. So then what we do is we have to investigate the patient and come to a conclusion that this is because of chronic kidney disease itself and not because of other disease. So we have to check for the cardiac conditions. Then we have to check for the thyroid profile of the patient, then the liver profile of the patient, and rule out the other differential diagnosis. Now, once we have diagnosed that this is a chronic kidney disease, then we have to zero down on the exact cause of the reason of which is causing the chronic kidney disease. Like it could be diabetes, it could be hypertension, that is high blood pressure, and it could be so many other causes of the kidneys. So for that, we perform a couple of investigations. So the basic workup of the chronic kidney disease first is the urine test. What we do, we look for urine proteins, the urine albumin creatinine ratio, and then we in the blood test we do the renal profile, which includes the creatinine, urea, uric acid, electrolytes, and some other tests of the blood we do to find out the cause of the renal failure. And for that we do the sonography also of the kidneys, and in the sonography of the kidneys we look for the structural causes of the disease of the kidneys. So whether what is the size of the kidneys, whether, and then sometimes we do a renal doppler also, that is the blood vessel, the blood supply to the kidney is also checked if we are suspecting something like renal artery stenosis or something like that. Then in some calculus diseases, some calculus are not visible on sonography, then we have to go ahead for a CT scan also. So renal scans are also done to pick up certain kidney diseases. Then in very rare cases, we have to do kidney biopsy also for very some rare causes of the chronic kidney disease. So this is how we firstly rule out the other differential diagnoses by the various tests, and then zero down on the kidney, and then within the kidney also we individualize, figure out what is the basic cause of the chronic kidney disease. And then once you diagnose it, then you have to treat the root cause of the disease and also treat the associated symptoms of disease. Like so many times there is anemia in chronic kidney disease. That is because the kidney secretes erythropoietin hormone, which helps in the production of the hemoglobin. So many times what we see is that in a chronic kidney disease patient, the hemoglobin of the patient is low. So we have to again give erythropoietin injections many a times to improve his hemoglobin, which will definitely improve the overall health of the patient and the overall well-being of the patient. Then we have to use certain medicines like diuretics. What diuretics do is they push the fluid out of the system, and that is how they reduce the pedal edema. And there are nowadays the newer diuretics which are there, which have lesser side effects. They are better in such conditions. And then we have to also advise the patient good lifestyle, modification of the lifestyle. Patient has to exercise regularly. Then he has to curtail down the salt intake and the potassium intake, and overall fluid restriction we have to advise according to the stages of CKD. Now there are 5 stages of CKD, so we have to individualize every patient, and accordingly the diet and the medication profile is tailor made for those individual patients. So this is how we do a basic workup for a chronic kidney disease, and we treat the chronic kidney disease. Thank you so much.